My name is Rashid. I'm from Dar es Salaam, Tanzania. After I got a knee injury while I was playing football in my country, I decided to come to India for further checkup and treatment, and I arrived here on the 19th of March.
I first saw Mr. Rashid Sheikha, a 39-year-old gentleman who hails from Dar es Salaam, Tanzania. To give you a brief insight, he had an injury to his left knee while playing football when he was tackled by his opponent. MRI was locally done back home, which showed that he had a tear of his main ligaments in the knee, which is the anterior cruciate ligament, or also called ACL, and a medial collateral ligament, which is the MCL. So both injuries were of grade 3, which means there was a total tear.
I'm an active person. I play football, jogging, I run marathons. So when I got this injury, it was really bad for me. So for 2 months, since then I've been struggling with being active again.
He was then referred to India for further treatment. When I saw him, I examined to find that he had instability in both planes, the front, back and the side-to-side plane, because of complete injuries to both the main ligaments of the knee, the ACL in the front and the MCL in the inner part of the knee. So I explained to him that the only way he can get back is by surgery, and this surgery would be carried out by a minimally invasive technique called an arthroscopy surgery.
24th of March, they did surgeries. Since then, I've been going through several supportive measures to ensure my recovery.
So he consented to the procedure, and we went ahead with an arthroscopic reconstruction of the ACL with his own ligament, which we call as a hamstring autograft. We also repaired his MCL, or the inner ligament, and also reinforced it, what we call as internal bracing.
After the surgery, I have hopes, but in few weeks I'll be able to get back to my normal routine. I think, and I probably believe that it is possible for ACL and MCL to be treated on the same at the same time.
So patient did very well post-op. Because of the associated MCL injury, we had to gradedly bend his knee about 30 degrees per week. At 5 weeks down line, he's absolutely walking fine without any support, and he's able to do a knee bend up to 120 degrees, and is continuing to improve every day.
Hopefully anyone that is afraid that after getting this type of injuries that will not make it, I think it's possible, and for me, I've seen it. My doctor, Dr Kini, from day one, I think, and all the nurses, my physiotherapy, Kalyan, he's been with me every day.
So these kind of multi-ligament injuries are common, either as a part of a sport injury, or also some two-wheeler accidents or four-wheeler accidents, and most of the time complete tear requires surgery, which is very well carried out through arthroscopic means. These patients do very well and are back to their sporting activities in 9 months to 1 year with a very good rehab team.
Manipal Hospital as well. It's a good hospital. Every person that you meet has been great and has been trying to assist all the time. I've been here. This for me is not the first time. Previous, I brought my sister here, and she got treatment, and so it's an hospital that I've been keep referring people where they have problems.